patient. Some of you are very stubborn. Some of you are very difficult to manage. So one of you came to the hospital today, and when he entered our unit, after telling me about his eyes, I asked him, sir, do you have any other medical history? He said no. And I looked at the man when he was even walking. He was walking in. I said, what do you mean by no? Okay, I went through the vitals. Of course, in our hospital, you must check vitals. I went through the vitals. 150/92. I'm like, sir, your BP is very high. I said, you are supposed to see a general practitioner. He said, no, I should leave the BP. It's the eye that brought him. You know about the BP. I said, so why didn't you tell me I have a medical? I asked you, do you have any other health problem? He said, no. Is BP not a health problem? When I went through the general practitioner's side, I saw that a general practitioner, I've already seen him, and the general practitioner wrote patient sin. So I was like, what do you mean by patient sin? I said, like, you have to go back to the general practitioner, let them give you drugs. This your BP is very, you're not even supposed to be walking around with this kind of BP. This man said, no, I should just, when I noticed that he was not listening to me, I went to the general practitioner and I saw this signature. Thankfully, me and the general practitioner were 5 and 6. So I went there, I said, Doc, Afana, this patient, look at what you wrote. You see the patient, I've been not seeing the patient. She was like, Doc, this man has been in my office for more than 30 minutes. And this 30 minutes this man spent in this consulting room was just me begging him to take his drugs and get bed rest. I even said they should admit him immediately. This man refused. I said, is that the problem? Even the nurse that took his vitals now walked in. I said that he told this man to take his medication and get a bed rest because this BP is very high, that the man refused treatment. So when I came back to our unit, I said, sir, I cannot see you with this kind of BP. Your BP is very high. I understand that the major reason why you came here is because of your eyes. Your high BP can also affect your eyes. So we have to monitor it first before I continue. The man said, oh, okay, so what do I want him to do? I said, I need you to take your drugs. The general practitioner have already told you that you need to be admitted now, that this is very high. The man said, no, he knows how to manage his BP. You know what? Once he reach home now, there's some kind of food he will eat, and the one he will not eat, the BP will just go down. I don't know.